Welcome to another Ultrasound of the Week. I'm Dr. Michael Schick. We have a very special one this week. 44-year-old male comes into the emergency department. He reports that he was kicked in the left shin weeks ago, but has noticed this growing left mass on his anterior shin. We do a brief physical exam. We notice there's a palpable 4 by 5 centimeter anterior leg mass on his mid shin. His pulses distally are a bit decreased, and you're not sure, but you feel like there's some pulsatility to this mass. So you use your point-of-care ultrasound and your linear probe. You see a anechoic mass, and then you apply some color. And with color, you can see that this is clearly a vascular mass. It's pulsatile, and it has directional flow. You thank your lucky stars that no one tried to IND this mass. And then you think about your differential diagnosis, which is basically between an AV fistula, pseudoaneurysm, or aneurysm. Now, AV fistulas typically occur with penetrating trauma. This patient's trauma was blunt, therefore pseudoaneurysm seems more likely. The flow is very directional, and the next step of evaluation would be to use spectral Doppler to categorize this as venous or arterial, although we feel it's arterial because of the pulsatility of it, and also to see the velocities. And this is what radiology will do when they evaluate AV fistulas. I'm also not getting that classic yin-yang sign, which is typically present when there's a dissection flap, true and false lumens, or thrombosis present. But a lack of a yin-yang sign doesn't rule it out either, and when taken at a different angle, the same vascular structure here looks like it does have that classic sign. It's great to identify these early with point-of-care ultrasound, and then typically the next step is to send these patients to radiology to get that full spectral Doppler analysis, and then you got to get your vascular surgeons involved. Patients may need follow-up studies, may need embolization, or even surgical fix.